So good morning everyone. Today we are discussing is the cardiovascular system. So here we shall be first discussing is the heart. So remember heart it is a muscular organ. It pumps blood throughout the circulatory system. So first of all where is heart located? So this heart it is located remember between the two lungs in the mediastinum. So the heart it has four chambers, two atria, right atrium, left atrium, and two ventricles, that is the right ventricle and the left ventricle. So the musculature of the ventricle, remember, they are thicker than that of atria. Means the force of contraction it depends on the muscle thickness. Now where is heart located? It is located between the two lungs in the mediastinum. And what are the four chambers of heart? The four chambers of heart, they are right atrium, right ventricle, left atrium and left ventricle. Now let us discuss about the right side of the heart. So the right side of the heart, remember it consists of the right atrium and right ventricle. So right atrium, remember right atrium, it's a thin wall, low pressure chamber that has SA node. So this one is the SA node. So the right atrium, remember it has the SA node that act as a pacemaker, and it has a AV node that is atrioventricular node. So remember it receives the deoxygenated blood through the superior vena cava and the inferior vena cava. So the right atrium it communicates with the right ventricle through this valve that is known as tricuspid valve, which then pumps the blood into the pulmonary artery to the lungs for oxygenation. Now the question is, what type of blood does the right atrium receive and through which vessel? So the right atrium, remember, it receives the deoxygenated blood via the superior and the inferior vena cava. What is the function of SA node? Remember, the SA node, it acts as a pacemaker. So the SA node, it produces cardiac impulses, and that is why it acts as heart's natural pacemaker. Now let us move to the left side of the heart. The left side of heart, remember, it comprises the left atrium and the left ventricle. The left atrium, remember, it is a thin walled low pressure chamber that receives the oxygenated blood. So it will receive the oxygenated blood from the lungs through the pulmonary veins. So the blood it passes from left atrium to left ventricle by a valve that is known as the mitral valve, or that is other name is bicuspid valve. So how does the blood move from left atrium to left ventricle? It's through the mitral valve that is also known as a bicuspid valve. So what is unique about the blood that flows through the pulmonary veins and the arteries. Remember, the pulmonary veins, it carries oxygenated blood from the lungs to heart, whereas the pulmonary arteries, it carries the deoxygenated blood from the heart to lung. That is opposite of the usual artery vein blood flow. Apart from that, there is septa, the right atrium and left atrium. They are separated by atrium interarterial septum, and right and left ventricle, they are separated by interventricular septum. So remember, the upper part of interventricular septum, it's membranous, while lower part is the muscular. So what separates the right and left atria? Remember, they are separated by interatrial septum. Now let us discuss about the layers of heart valve. The heart valve, it has an outer pericardium, the middle layer is the myocardium, and the inner layer is the endocardium. So what are the three layers of the heart valve? They are pericardium, myocardium, and the endocardium. So the pericardium, remember, it's the outer covering of the heart. It consists of outer parietal pericardium and inner visceral pericardium. The pericardial cavity, between these layers, it contains thin film of fluid. So why is this pericardial fluid important? It reduces the friction between the heart and pericardium during the heartbeat. The other is the myocardium. Myocardium is the middle layer of the heart valve that is formed by cardiac muscles or myocytes, and it is responsible for the pumping action. So remember, the myocardium, it consists of three types of muscles. One are the contractile fibers, other are the pacemaker fibers, and third is the conductive system fibers. So these fibers, remember, they are striated with central place nuclei. So remember, the pacemaker generates the impulses for the heartbeat. The SA node is the heart's natural pacemaker. The conductive system, remember, the conductive system is formed by modified cardiac muscle fibers that transmit the impulses from SA node to the atria directly and to the ventricles through various components of the conducting system. The last layer is the endocardium. It is the innermost layer of the heart valve. It lines the surface of heart and continues as endothelium of the blood vessels. Now coming to the valves of heart, there are 4 valves in a human heart. 2 are AV valves and 2 are the semilunar valves. So these valves have a unidirectional blood flow. The left AV valve, or it is also known as mitral valve, it has 2 cusps, while the right AV valve or the tricuspid valve, it has 3 cusps. So these valves, they are connected by the coda tendineae that prevents the backflow during the ventricular contraction. Apart from that, there are semilunar valves, aortic and pulmonary valves. They have 3 flaps and prevent the backflow into the ventricles. So what is the function of the heart valves? The heart valves, they permit the blood flow in one direction and prevent backflow. Now let us discuss the action of heart. So first of all, chronotropic. that is frequency of heartbeat or heart rate. It can be either tachycardia, when there is increase in heart rate we term it as tachycardia, and when there is decrease in the heart rate we called it as a bradycardia. So chronotropic action is, remember, frequency of heartbeat. Inotropic action is force of contraction. It can be either positive or negative. Other is dromotropic, that indicate the conduction of impulses. It can be positive or negative dromotropic effect. Other is bathmotropic, that is based on the excitability of the cardiac muscle. Now remember the arterial system, it includes the aorta, arteries, arterioles, that is composed of outer tunica media. The outer layer is tunica adventitia. The middle is tunica media, that consists of smooth muscle, and inner is tunica intima, that is composed of endothelium. The venous system starts with the venules, which are thin-walled vessels, continuing as veins or vena cava. So the inflammation of the veins we use is phlebitis, that can lead to formation of clot, that can cause thrombosis. So if the clot dislodge, it becomes a thrombus that travels through the bloodstream, and it can become an emboli. So these emboli would obstruct the blood flow to the vital organs like the brain, heart, lungs, that can lead to the severe complication. Now let us discuss the the blood flow through that occurs to through the two main division of the circulatory system. The first is the systemic circulation, other is the pulmonary circulation. The systemic circulation is also known as greater circulation. The blood, it is pumped from the left ventricle into the arterial system. It passes through the blood vessels and reaches the tissue. In capillaries, exchange of the substance occurs between the blood and the tissue, and after the exchange, blood enters into the venous system and it returns to the right atrium of the heart. From the right atrium, it moves to the right ventricle. So remember, through systemic circulation, oxygenated blood is delivered from heart to tissues, and venous blood returns from heart to the tissue. Other is the pulmonary circulation. It is also known as lesser circulation. The blood is pumped from the right ventricle to the lung via the pulmonary artery. In pulmonary capillary, gas exchange occurs between the blood and the alveoli of lung. The oxygenated blood, it returns to the left atrium through the pulmonary veins. So in pulmonary circulation, the left side of heart contains oxygenated blood, while the right side of it contains the deoxygenated blood. So what is the main function of the pulmonary circulation? To facilitate the gas exchange between the blood and the alveoli in the lungs, returning oxygenated blood to the left atrium. So which side of heart it contains oxygenated blood and which side contains deoxygenated blood? The left side of the heart, it contains the oxygenated blood, and the right side contains the deoxygenated blood.